and sisters, my fellow Guyanese. GHK Lall on Kaieteur Radio 99.1 and 99.5 FM. Welcome to the Friday, March 26th edition of the National Outlook. As we head into the weekend, we have Palm Sunday on Sunday, and we have Pagua on Sunday also. These are traditionally, and I don't see this year being any different, these are traditionally 2 days where we have mass gatherings. We have them in churches, we have them in the mandirs, we have them in the villages, and we even have a little bit of it in the city. We have it in just about all the villages, well-populated villages, and people get close. That's part of the spirit of the celebration of Pagua particularly. Palm Sunday, we have these mass congregations. It's the beginning of Holy Week, the most sacred time in the Christian calendar. And I think it's timely for us to face something that we have been talking about for a while now. It's about COVID, and it's a sobering question raised by Dr. Zulfikar Books of the Emergency Services at the Georgetown Hospital. And he says, coronavirus, is it fair to show utter disregard for guidelines and health workers have to pay the consequences? This is a little different take here. We know what we have to do, but unfortunately, quite a few of us are not doing so. When we don't wear masks, when we don't observe social distancing protocols and sanitizing protocols. As a matter of fact, on Ash Wednesday, we asked a gentleman, we asked a couple of people to just shift to observe the spacing, and a man got so upset that he walked out of the church. I mean, you came to pray. Nobody insulted you, nobody spoke to you harshly, and this is what you do. Observe the social distancing and other protocols, and we ended up there. It was handled quietly, but that's part of some things that are a little bit too much of the touching the norm. The health workers having to pay the consequences. Look, we go to the hospital, and we normally, our health workers, our nurses, our doctors and attendants, they say, okay, you've got a temperature and your pulse is racing, so, and whatever else, you're stuffy, you've got all the symptoms of a flu. They're not really fearful, although the influenza can be contagious, the droplets. But now, with the coronavirus, there's this great fear on the part of health workers. Sure, they have masks and gloves and PPE, and they're functioning, but day after day and all day long, they have to face whoever comes before them. It could be you, hopefully not. It could be somebody else, hopefully not. But the numbers, people are dying, and the cases are rising, and they're there. We're approaching 10,000 cases, so we should always be cognizant of Brazil next door and what is happening there. So our health workers, they have families too. They have to go home too. They have their own anxieties. In the United States, a couple of doctors committed suicide. The pressures are intense, and what Dr. Buck says, it's never easy to see your patient die, much less seeing them suffer slowly, begging for help, and knowing that you have done all you could have, but the virus will win this battle. The virus will win this battle, meaning it's gone so far that the patient is going to die. The patient is going to die. So, and then the health workers have to come back tomorrow and to start over by facing that all over again. So, let us see what we can do, my brothers and sisters, my fellow citizens. Let us see what we can do. We have a part to play here. I had my vaccine. It's about, almost 2 weeks ago. And now I see the government that says we want to do 10,000 vaccines a day. That's a tall order, but I think it can be done. They're going down to the just over 40 age bracket. And so more and more will be absorbed into the vaccine procedural system and get that first shot. AstraZeneca, there's some thoughts about that, but the numbers are good, and that the reputable authoritative agencies have pronounced positively on it. I think we need to do our part, wear our masks, get vaccines, wash our hands, sanitize, social distancing. Let's protect our health workers. It starts by protecting ourselves. We protect our families that way, and we protect them too, so they can go home confidently and come back tomorrow with renewed energy to serve us. Until next week, this is GHK Lall on Kaieteur Radio 99.1 and 99.5 FM. Thank you for joining us on the National Outlook, and do have a blessed Palm Sunday and a wonderful Pagua.